Hello, everybody. We appreciate you joining us. I'm joined by FOX13 investigative reporter Taylor Stevens, who's been doing some amazing work with her series Care in Crisis. You've probably caught some of them, but in total, she's done 15 different stories looking at Utah's nursing homes and just a lot of the things around them that you need to know. So we wanted to have this conversation, bring the viewers in, be able to ask any of those questions. You can comment your questions. We can see all of them. We can respond to them. And Taylor has so much incredible knowledge. She's been researching this for months. In fact, almost a year, right, Taylor? This has been a long journey that you've been on. And we have actually, to kick us off here, as some more people join us. And I know that as the Facebook Live and YouTube Live go a little bit further, we'll have even more join us. So again, chime in the comments if you are there. But we do have a little video that kind of goes through 5 takeaways that you learned from this series. So I'm going to go ahead and play that, and then we'll come back on and talk about a bunch of stuff with that reporting.
Whether it's now or later, like a lot of people are going to end up here, and a lot of people are going to have parents or family members end up in these places.
As Utah's population ages, the systems meant to protect, support, and care for our older and disabled adults will grow increasingly important.
This is an industry in crisis.
I feel like these residents deserve better.
But a months-long FOX13 investigation raises questions about how well these systems are serving those who need them.
It's in our best interest to improve the experience that residents have in these facilities because this is our future. Our state is aging.
I'm FOX13 investigative reporter Taylor Stevens. Here are 5 takeaways from our reporting. Based on our review of 4,000 pages of federal inspection reports, dozens of police reports and lawsuits, and nearly 20 interviews with researchers, service providers, government officials, attorneys, and families and their loved ones who rely on this care.
If people aren't aware of it, nothing will ever change.
Takeaway number 1, Utah's government-owned nursing homes have received hundreds of millions of dollars through a program meant to improve care. But a recent state audit shows about half of that money, or about $450 million, wasn't spent at the nursing homes the funds were meant to help, as metrics raise concerns about their quality of care.
The money is being taken away from its intended purpose.
The audit says 51% of the money was used for a combination of owner compensation, administrative costs, and hospital operating expenses. The hospitals that own these nursing homes say they're in compliance with state and federal law, but advocates say that money could have made a big difference for residents.
We're seeing all of the problems, all of the injuries, all of the death that likely and probably would have prevented those injuries and those deaths if that money had been used.
Takeaway 2, about a third of Utah's nursing homes are understaffed, with below average or much below average federal staffing ratings. And experts say understaffing puts residents at higher risk of abuse and neglect. Utah currently requires only that facilities have sufficient staffing, a vague standard that can leave a lot of room for discretion. And some hope to see state legislators implement a minimum staffing standard statewide.
What would that look like? What impact would that have on facilities' ability to function? And what impact would that have on the quality of care and life of the residents? Those are all really good questions worth exploring.
Takeaway 3, sexual abuse is an underreported but unfortunate reality in long-term care facilities. We found federal regulators have cited Utah nursing homes at least 25 times since 2019 for failing to protect residents from sexual abuse. Because these allegations are commonly underreported, it's hard to know the true prevalence, but we saw some instances where perpetrators explicitly targeted older adults with cognitive deficits.
If you're seeing bruising, unexplained bruising or injury to that person, particularly in the genital area or in the private areas of the person, that certainly should raise questions.
Experts say families need to be aware this is a possibility and say better staffing could help reduce or even prevent incidents of sexual abuse.
The more eyes that are available in a nursing home to monitor, to check in on residents can ensure that residents are protected.
Takeaway 4. Hundreds of older adults, often with cognitive deficits, have wandered away from assisted living facilities and nursing homes. We found nearly 230 cases since 2019. Records show some sustained frostbite in the winter or suffered burns from falls on the pavement in the summer. At least one nursing home resident died after he fell into a body of water and drowned.
Too many families have lost loved ones with dementia to wandering.
Experts say this is another issue that can be addressed with improved staffing, as well as better training for staff and administrators.
If we can identify the more minor incidents, we can prevent the more serious ones and save lives.
Takeaway 5. Utah's Adult Protective Services investigators substantiate a far smaller percentage of claims of abuse, neglect, and exploitation than the national average. They uphold just 5% of cases, compared to 29% nationally.
That would raise red flags to me, extremely, that it's so much significantly less than the national level.
Some advocates worry that reflects low-quality investigations, as data shows some caseworkers were handling almost triple the recommended caseload in the first half of last year.
We're clearly missing something.
APS told us Utah has a high bar for substantiating cases, which may account for the lower substantiation rates, and says the agency is working with policymakers to reduce high caseloads.
We're certainly aware of that issue and are working with executive and legislative branch partners to make inroads on that.
The FOX13 Investigates team will continue to look at Utah's elder care systems over the coming months. If there's a story you'd like us to look into, you can email us at iteam@fox13now.com. In the studio, Taylor Stevens, FOX13 News, Utah.
Taylor, amazing work. I think it's really crazy that you were able to distill 5 things out of this, going through so many of these investigations, as we said earlier, 15 stories. But I wanted to talk to you and start this conversation as people chime in as well in the comments on Facebook. But why did you start this reporting? What was the main reason that you wanted to look into this in the first place?
Yeah, Utah is known for having the youngest population in the country, and I think that as reporters in Utah, we do a really good job covering issues that affect teenagers, that affect children, and those are all really important issues. But it felt to me like there was a bit of a gap when it came to coverage of older adults, and we know our population is aging. A lot of people are caring for aging parents, aging loved ones, kind of that sandwich generation that we talk about a lot of times, people caring for their kids, caring for their parents. And it felt like a big gap to me where we just haven't seen as much good reporting. And so when I started looking into this, it took I thought we might do one story about this issue and ended up doing 15, which I think is a testament to just how much work there was to do in this space. And one thing that I think kind of exemplifies how little reporting there had been on this, when we talked to the long-term care ombudsman, Allie-Ann Sipes, who you saw in that story, she is kind of the main advocate for residents in assisted living facilities and nursing homes in Utah. And she said it was the first time she'd ever spoken to a reporter in more than 3 years in that position. Wow. So it's just, something that we haven't focused on enough. And I, gotten a lot of emails from people who are feeling seen and saying like, hey, my mom is in one of these facilities, or my dad or my grandpa, and I experienced this. And so I think that it's something that people really care about, but that for whatever reason, we just weren't focused on enough.
Yeah, and I know that a lot of this was document diving for you and looking through so many different things. But one of the main trends, you saw it in that overview that we just saw, those 5 takeaways, as well as several of the stories, including one main story. But staffing is one of those issues. So let's talk about that 1,000-foot perspective. What is staffing like across the state of Utah? Is there any trends that you're seeing?
Yeah, so when we look at staffing, It can be difficult, especially in assisted living facilities, to really understand what staffing is like. Nursing homes, we have a little bit more insight into because the federal government has a tool that you can use to, they're in those facilities inspecting them, and we can talk about that tool a little bit later. But, what that tool shows is that about a third of Utah's nursing homes have below average or much below average staffing. And experts tell us that staffing is one of the most important markers of quality of care in a facility, that if you have fewer staff, you're more likely to have instances of abuse and neglect. And it kind of runs into a lot of the other stories that we reported on. We talked about wrongful deaths, and a lot of those lawsuits allege that facilities were understaffed. We talked about people often with cognitive deficits like dementia wandering away from a care facility. Seems like staffing and lack of oversight often plays into those issues, which can have really severe and devastating consequences. Sexual abuse, all kinds of problems that happen in a facility. Often there's allegations that that facility wasn't properly staffed or didn't have enough people on hand. And so it's a complicated issue. When we spoke with the Utah Healthcare Association, told us that they really want to hire more people in a lot of these facilities, but that there's workforce shortages. Also, low pay can play in. Sometimes these people that are tasked with, really caring for our family members and our loved ones are not being paid a living wage, or a wage that, they couldn't get doing some other kind of work. And so that can play in as well. The Department of Health and Human Services showed us some data that RNs in Medicaid facilities have had increases in their wages since 2020, but we know that a lot of healthcare workers are burned out, that they're overworked, that there's not enough of them, and it kind of creates this cycle where people want to leave because they don't feel like they can keep their patients safe, or they don't have, the resources and tools that they need in these facilities. So it's a big problem, and definitely runs through every other issue that we looked at.
Yeah, absolutely. You mentioned that tool. I want to pull that up. That was something you sent me a little bit earlier. So let me get that up. And, for those of you that are in the chat, I will put that link as well. But let me get that up. So this is the website that you were kind of talking about. So I want you to kind of walk me through this. And before we do that, I want to make sure that QR code you see right above me, that will actually take you directly to this site, and you can follow along, and I will also comment it afterwards. So you can go directly to it for our viewers that are out there. But, if you want to tag people and get them, this is probably one of the most important things. It's very easy, or at least it looks very easy. You're going to walk me through it. You've told me it's easy to do, and I trust you. So go ahead and walk me through this. We're going to start from page 1. Where does somebody go to make sure that they can look at all this information?
Yeah, so this is the Center for Medicare and Medicaid Services Care Compare tool. And so this gives you a lot of insight into Utah's nursing homes. So if you or a loved one is looking for care, experts do say try to do your homework and see if you can find the facility that's the right fit for you and your family. And so this tool can kind of help with some of that research. So if you scroll down a little bit, Spencer, you can find, nursing homes, including rehab services there on the side. And if we search Utah, we can just find all of those facilities in the state.
Right.
So
And you can search, name a facility here. So if you wanted to search a very specific facility your loved one is, you could do that as well. But
yeah, you can also search by zip code if you want to, find one that's close to you. But we'll just look at all 97 of the nursing homes in Utah. And so you can see that right now they're in alphabetical order. You can see their star ratings. So CMS has regulators that are going into facilities on a regular basis, and they are looking at staffing, looking at some quality measures, and looking at health inspection reports. And that overall rating that you see is kind of a combination of these various metrics. So if we click into one of those, you can see, so the overall rating, 5 stars, higher stars are better, lower stars or worse. And we can see, you know, their health inspection ratings, their staffing ratings, and their quality measures. And you can actually get pretty deep into some of this depending on how, you know, deep you want to dive. If you press into the view inspection results on the health inspections tab and you scroll down a little bit, you can see, okay, their most recent inspection was April 10th of 2024. So it's been a little while. But if you wanted to click on that PDF, then you could pull that up and actually read that report, see what health inspectors kind of brought up specifically when they went into a facility. And so that can be insightful just in understanding some of those issues. So then if you go back out of that, you can also get a little bit deeper into staffing metrics. So if you click on view staffing information, so we can see kind of average number of residents per day, the total number of nurse staff hours per resident per day, some of these metrics that can kind of help us understand like what is the day-to-day caseload looking like in a facility. And it's helpful that it provides the national average and the Utah average. So you can kind of compare what are things like nationally, what are things like here in Utah, and that can kind of give you a benchmark of how is this facility doing. They also have some of those turnover data that we were talking about earlier, and the turnover rate in Utah, you can see here the national average is 46.2%. Utah's average turnover is 51.1%. So we do have a higher turnover in Utah facilities than national average. And that makes a difference as well, because when you have that high staff turnover, you're always kind of training people. People are always coming in and out of a facility. So that can kind of lead to more burnout as well. So those are all just things that can kind of help you understand a little bit more what's going on inside of a facility. Experts also say, you know, drop in for a visit, give them a call. Like, this shouldn't be seen as the only end all be all of your search or of trying to understand what's going on in a facility, but it can certainly help and offer some ideas for questions that you might want to ask, details that you might want to know. And then one other thing, if you'll click back into like any individual nursing home, you can also see, so at the top right, so scroll up just a little bit, you can see whether it's part of a chain, who its owners are. And if that's important to you, like maybe you like a particular chain or you don't like a particular chain, or you want to understand more about that chain, then you can kind of see who's actually operating and owning this facility, which can be instructive as well.
Yeah, and that's a really good point, because one of the things that you and I have talked about a lot, and you've covered a lot in this series, is just the ownerships and the chains. So talk to me a little bit about that. Why is that important? Why is that something that people should look at and care about?
Yeah, so one of the things that is interesting with ownership here in Utah when it comes to nursing homes is that many Utah nursing homes are part of this program called the upper payment limit. And the upper payment limit can be kind of tricky to explain, but the long and short of it is that these facilities have to be owned by a government entity, so a city or a county. It can't be a state entity. And if they're owned by a government entity, that they have access to additional federal funds that can help improve care at the facility. That's kind of the goal of this program. And a lot of nursing homes are part of this program. And some of the biggest players in this program are small rural communities. So Beaver Valley, I believe they own 44, maybe 45 of Utah's nursing homes. I don't have that number in front of me right now, but a significant number of nursing homes for a rural community. And Gunnison Valley also owns several. And so you have rural communities that are owning, you know, many of the nursing homes in the state to get this extra money. And so we kind of kicked off this series looking at some concerns among advocates who felt like, you know, where is this money going? That they had some data that seemed to raise concerns about care in those facilities, that those facilities didn't have as quality of care as, you know, other facilities that aren't part of that program aren't getting that extra money. And we actually got a lot more detail about that program and how it's working earlier this year when the state auditor released an audit that looked at that program. And what she found was that 51% of the money that has gone through that program over the last decade or so, and that's about $1 billion in federal funds, have about 51% of that money never was spent at the nursing homes on care, that it went to administrative costs and owner compensation, these types of things. And so, for advocates, that really raised some red flags of like, is that reasonable? The state auditor said that a reasonable administrative fee of what she's seen and what has been established in case law is more like 1 to 3%. So 51% is, obviously we can all do the math there, quite a bit higher than that. These hospitals, the rural hospitals that own these nursing homes, say that they're in compliance with state and federal law, that it's, part of what they need in order to keep this program going, that they have administrative costs. But, the funding is a really important piece. And we hear this, not just in Utah, but nationally, is where is the money going, and that it can be difficult to understand exactly where money is going. And so it also can be hard for people to know. I've talked to a lot of families that have reached out to me and said, like, is my nursing home part of this program? Is my mom's nursing home part of this program? And a lot of people don't know because the government owners don't actually operate these facilities. They outsource that to these private management companies. So private management companies continue to do the day-to-day operations. And so a lot of people reached out to us saying, hey, I want to know how much money has my mom's nursing home or my dad's nursing home gotten through this program. So we put together, based on state documents, some state records that are publicly available. We kind of compiled those to show everyone, these are the programs, or these are the nursing homes, that are part of this program, and here's how much money they've received. So you can see, and we'll just take, again, not to pick on any particular nursing home, but A is at the top. So Alpine Meadow Rehabilitation and Nursing in West Valley City is owned by Beaver Valley Hospital. It has that CMS overall star rating that we've included in there, and that comes from the CMS Care Compare website that we showed you just a few minutes ago.
And real quick, I did just change for our viewers that are looking, this QR code in the corner will take you directly to this site if you want to follow along with us as well. Sorry, Taylor, go ahead, take it away.
No worries. Yeah, we've also kind of, not all of these programs have been not all these nursing homes have been in this program for the same amount of time. So you can kind of see like how long have they been part of it and how much money have they received through this program during this time. And so, it's just one of those things where this program can be a little bit hard for people to understand, and people have a lot of questions about it. So I think that this can be a helpful resource just in that transparency aspect and people understanding their ownership, the operations, and just getting a little bit more, again, details about what's going on inside of these nursing homes, and kind of understanding, as we all try to understand, where is this money going? Is it making a difference? And how is it affecting the people that rely on this care and really need it the most?
Yeah, and this was just, to give you some kudos on this. This was something you put together of sourcing this everywhere. So this is a great resource for people that want to look up those individual places. As we're kind of winding down here, and again, anybody have any questions, want to ask Taylor anything in particular, go ahead and put it in the comments. But one of the things I am curious about is, what was one of the most surprising things you found as a part of looking into all of this?
Yeah, so as part of this reporting, I read about 4,000 pages of federal inspection reports, which is those documents that we showed you a little bit earlier, where you can see what were the nursing homes cited for, what were some of the issues inside of a facility. Because I just kind of wanted to understand, what's going on, what are some of the problems. And it really surprised me when I started seeing issues of sexual abuse, whether between residents or sometimes perpetrated by a staff member. And can be a really complicated issue because those two things are not necessarily created equal. You might have fellow residents in a facility who are sexually abusing another resident who are not, like, that person is not cognitively capable. They have, some issues. We talked to one family who their mother was sexually abused in a facility by a fellow resident who had cognitive issues, and they didn't blame that resident. They felt like he didn't have like the cognitive capacity to really understand what he was doing, but they, again, going back to staffing, felt like that facility didn't have enough staffing in order to protect their mom from that situation. So, those are complicated, but the ones that are really heartbreaking, I mean, even more in some ways heart-wrenching, are the ones where your family member was explicitly targeted by whether that be a staff member or another resident who has cognitive capacity. And what we saw is several residents who were, had dementia or weren't able to make a report, that they would be explicitly targeted for sexual abuse by people who felt, in one case we had staff member at a facility who told officers after he was arrested for sexually abusing several nursing home residents. Excuse me, this was at an assisted living facility. Several residents at a facility, he said, I thought I could do it and get away with it because there's not much these residents can do about it. And so that was something, I've been in this business a long time and read a lot of horrible things, but I didn't expect that would be something that would happen. And that's what I heard from experts, is like, this is something sometimes families don't know to look for, because you don't expect that somebody is going to explicitly target your family member. And so there was a lot of advice in that, of just like having that awareness, keeping an eye out. And again, I want to stress, these are rare cases. This isn't something that's happening all the time, but it's possibly happening more than we know, because sometimes these residents can't report. And we also know that sometimes when they report, they aren't believed. The long-term care ombudsman told us about a case recently in a facility where several residents at a nursing home had said that they were sexually abused by a resident, I believe. I'm not actually sure if it was a resident or a staff member, but that they had been sexually abused by someone in the facility. And they had reported this several times, but because they had dementia, they weren't believed until it was caught on camera. And once it was caught on camera, they moved forward with charges against this person. But, that creates all kind of complicated dynamics around privacy and, for your loved one, putting a camera in their room, and different facilities have different regulations on that sometimes. But that really surprised me, and I thought was important for people to just be aware of, not to scare anyone or to make anyone think that that's definitely going to happen to their loved one, but just to know that it can, and that they should keep an eye out for some of the warning signs, bruising, unexplained fear. There was one woman who, her family is suing a facility after she was sexually abused, and her family started seeing that she was hiding under the bed, and that was new behavior for her, but she couldn't really communicate with them. They didn't know exactly what was going on. And so sometimes if you're seeing these signs, it's important just to take that seriously, and because this can have really big impacts, not only emotionally but physically, for older adults who are vulnerable and who might not be able to speak up for themselves. So I think as family members, knowing that that's something just to keep an eye out for is important. But that was really surprising and sad to me, that that's something a family would have to worry about and think about.
Yeah, it's horrible. And it's horrible that they are seeking treatment, seeking to get better, and seeking to stay healthy, and that things like that can happen. I want to ask you, and this may be difficult, and I'll actually bring up the takeaways in terms of all of the takeaways that you have. This is the story we just watched at the beginning, the web story for it. In fact, I'm actually going to put up the QR code for it too. That's the new QR code right above me to take you to this website. But I want to ask you, what is the number one thing that people should be aware of or maybe a couple of things, but maybe that prevalent thing that the people watching now, the people that you hope watch this series, take away from this reporting and take away knowing that a lot of Utahns have their loved ones or will have their loved one in a facility like these?
You know, I talked to a lot of families about this, and as I was doing interviews, like what I asked them, what do you want people to know? What are your kind of takeaways? And one thing that really stuck out to me that many people have said to us is, you know, you put a lot of trust in a facility when you place a family member there, and it's not necessarily to expect that they're going to break that trust, but also just to know that you have a role as a family member to be engaged, to be present, to ask questions, and to advocate for your family members. A lot of people who have emailed me are not aware of a few resources that they can reach out to if they have concerns in a facility. So I'll mention those here. One is the Long-Term Care Ombudsman's Office, and the Long-Term Care Ombudsman is an advocate for residents. Their role is to try and mediate any issues that might come up at a facility. And so they deal with things ranging from, you know, residents who aren't getting showers at the time of day that they think they want to be showered. You know, there are rights that people have in facilities when it's their home, all the way to, you know, more serious issues or more kind of life-threatening kind of things that they might be able to help, like staffing, for example. You know, someone could argue that that's a life-threatening issue, and so they can kind of mediate and deal with some of those things. And they would encourage people to reach out if they have concerns or questions, and they can kind of also help connect people to other resources that might be helpful. The other one is Adult Protective Services. Adult Protective Services, their jurisdiction is any adult. I believe it's 65 and older. It might be 60 and older. I should know that. Click on the story, Spencer, about Adult Protective Services.
There's a lot of them in here. I want to make sure to get the right one.
Oh, there it is.
And by the way, this is all, yeah, here we go. These are all the stories Taylor has done, and I'll get back to this in a moment, just so you can all look for further stuff. So let's see. Let's try and find. Do you remember where it is in the article? 60 to 65.
No, I don't. Sorry, but I think it's anyway, 60 or 65, but also any adult 18 and over who has a vulnerability. And so if you have like a loved one in a facility who has maybe a cognitive deficit, even if they're not in that age range, Adult Protective Services is the place to make a complaint if you have a concern about neglect, exploitation, or abuse. We did find that they're substantiating a far smaller percentage of complaints than the national average, which is concerning to a lot of advocates, and they feel that that might point to understaffing. We do know that a lot of APS investigators have much higher caseloads than ideally they should, but you know, that's just another resource that people sometimes aren't familiar with or don't know about, and so just want to reference that there.
Yeah, and I think there's so much in-depth reporting you've done on here. You know, even as we're going on 35 minutes here, you know, just barely scratching the surface. But this is where we wanted to show people where you can look for all of our reporting. So this is the story that was just released yesterday. It's what you watched at the top of this live stream. Taylor, you've written up a lot of those takeaways. There's, I believe, 9 in this article that you can read through. But if you scroll to the very bottom of this article, you can see a link to all of the stories that you did through this process. And again, you can scan that QR code right above my screen, and it'll take you right above my head, and it'll take you directly to all of those stories that are so impactful. I mean, it was a pleasure to get to watch you go through this process in terms of developing these stories and talk with so many individuals. I'm sure so many people, as you said, I've seen the emails come in too to our newsroom talking about you helping them in terms of finding out more about their loved one's facility. We've seen, other people reach out to us. So it just goes to show you how impactful this reporting is to so many people. I want to put this up just as a final thing. So this is the investigative team's email, iteam@fox13now.com. And if you are able to, if there's something that you would like to reach out to our investigative team, which includes Taylor, you can email this right here, iteam@fox13now.com. Taylor, thank you so much for your reporting. I should ask, as much as this series has kind of concluded as of now, this isn't the last that you're going to be looking into this, right?
No. And before I get into that, I just want to say it's 65 and older for adult protective services.
65 and older.
What
There we
I
go.
originally thought, but we like to fact check and double check things here. But yeah, we'll continue reporting on these issues. We're definitely not done looking at this. I think there's a lot to come. These are complicated systems that take a long time to fix and address, but I think awareness is the first step. And so, we are expecting that we'll continue to see conversations around some of the issues that we've been exploring, and we'll continue to cover those. But yeah, we are always open to hearing from viewers about this reporting. If you have a story idea related to this or something else that you want us to look into, or just if you have questions, I've been getting a lot of emails from people that just say, how do I know this, or how do I look at that? And I can send you in the right direction, or send you to one of our stories to learn more about it. But yeah, it's really appreciate. Every person that has talked to us for this series, both on and off the record. We've talked to experts, families, service providers, government officials, people just on all different levels of this. And it's been really interesting and insightful to learn about, just for me personally. And I hope that we have been able to shed some light on some of these issues in a way that's helpful for people here in Utah, because I do think these are very important and consequential issues that affect people that we love. My family is here in Utah, my parents, my grandparents. I want them to have great facilities to go to if that's something that they need. And so I think it's really important that we continue to focus on these issues and continue to report.
Thank you, Taylor. I appreciate you so much. I know so many Utahns out there are going to use this, and it's kind of beautiful. You've built these systems as well that people can look at and make sure that at least for now, look at their facilities and things like that. So I know so many Utahns are appreciating you right now. So that's the conclusion. We appreciate you all for joining us. And of course, one more time, a plug for this email right here, iteam@fox13now.com. Reach out to it if you have anything about nursing homes or beyond, anything you'd like us to investigate. And of course, we'll continue to follow this issue. Taylor, thank you so much. And we appreciate you all for joining us.
Thank you.